am Dr. Erica Monique Broussard. I practice at Ochsner Health System, specifically the Tansy Breast Center, located near the main campus of Ochsner, and I'm the medical director of radiology at Ochsner Baptist. I was asked today to talk on some things on behalf of Breast Cancer Awareness Month and how that relates to STDs, in particular HIV/AIDS. And I think the good thing to know is that there is no direct correlation with breast cancer and HIV/AIDS. So breast cancer is not an AIDS-defining illness. If someone is diagnosed with breast cancer, the treatment for breast cancer is not affected in any way because of the diagnosis of HIV/AIDS. And so it is just what we call a comorbidity. So it's an additional a condition or disease or something that has to be tackled in the body. Breast cancer is in addition to HIV/AIDS. What we do notice in general, whether it's breast cancer or other types of cancers, are some of the social factors that have contributed to the contracting or acquiring the HIV/AIDS can lead some people and some patients to get care later. So if someone knows that they have HIV/AIDS but is dealing with some difficult personal issues, that may cause them to delay seeking treatment for that lump they feel in their breast. And that goes for basically any patients who are dealing with any social issues. So it's not that the social issues related to HIV/AIDS are some kind of way special, such that these patients present at a much later time than someone who may be dealing with depression or someone who has hepatitis or anything else. And so what we want patients to know, and we want you all to know, is that from a physician standpoint, when we interact with you, if you come to our clinic, to our department for an issue that may be going on in your breast, you're pretty much anonymous. No one knows in our department that you have HIV unless you tell us, okay? And that goes on through the biopsy and where blood is involved and what have you. And it's not a lot of blood, and the biopsies are very simple and painless. But if you don't volunteer that information, we have no idea. So no one is kind of tippy-toeing around wondering, oh, I don't want to put my gloves on because this patient may have HIV/AIDS. We have no idea. We do the biopsy like you were just any other patient. Everybody gets fair and equal treatment in our pursuit to ensure that you don't have breast cancer, or if you do have breast cancer, that you are being taken care of appropriately. The only time that we may ever ask you whether you have HIV/AIDS or that's a known diagnosis is occasionally we may stick ourselves with a needle, and it doesn't happen that often, but that may cause us to have exposure to whatever blood-borne illness the patient may have. And in that instance, if you don't know your status, we may ask you to get tested. You could refuse, but we would ask, and it would be extremely helpful to us to be able to protect ourselves. And if you don't, if you just opt to not get tested or not divulge your status, then there are just a bunch of extra things that the physician or nurse would need to do that we can do, and it's not an issue. So the bottom line is that we have no idea. So if you have an issue with your breast, if you're concerned about a lump, if you think you may have cancer, don't let your diagnosis of HIV/AIDS deter you in any way. For younger patients, there are all sorts of things that you may experience in your breast, and the likelihood that those things are cancer are extremely rare, but not zero. Unfortunately, we've had early patients in our early 20s, even this year, 23, 24, 28, who have been diagnosed with breast cancer. And those patients stick out to us because, of course, it's the handful of very young people, and those things just kind of stick in your mind, but surely not the majority of patients. But there are other masses that can be found in the breast that are benign, but you may not know and may need to get those checked out. And those would include something called a cyst. A cyst is just a fluid-filled sac in the breast. Think of it like a water balloon. All women get them. They're usually related to the ducts, and they're completely normal, but they can be pretty large and they can be pretty painful. And it's not something that you should hesitate one bit to come and get it checked out. That would usually just involve a simple ultrasound procedure. Again, a painless procedure. If you're under 40, that's usually all it would involve, and we can tell pretty easily whether it's a cyst or something solid. There are solid masses which are cancerous, but there are also solid masses that are not non-cancerous, benign we would call them. And in the younger patient population, teens, all the way up to 30s, 40s, early 40s, these masses are very common, these benign non-cancerous masses, and they can also hurt. Be sore and tender and painful, and so you shouldn't hesitate to come and get that checked out because of any other diagnosis you have. We can check those out very easily with ultrasound. Usually every now and then some of those things would require a biopsy, which is a simple procedure. It's not a surgery, and again, if it required that biopsy, we would not have any idea, even if you bled all over us, whether you had HIV/AIDS. And so don't let any of those things ever deter you from coming and making sure you're healthy and that your breasts are healthy.